Hi, Chris. Welcome back to Revitalize Womanhood. I'm so excited to have you back for part two.
Deuce, let's do this.
Let's do this. So, ladies, I have had an onset of questions from you, pouring from every outlet that I get messages from this episode because it obviously struck a nerve. It's something we all worry about, it's something we all think about. And I kind of want to back up a little bit from the first episode when Chris told us about the fact that he does this as a telehealth. He does this with clients, I should say, clients from different states, Hawaii, Seattle, whatever, even though he is located in Gilbert, Arizona, that doesn't matter. He still has patients that are around the country. So here's what I want to talk about. Imagine I'm Gina coming in off the street, but not off the street because I'm going to do a telehealth call with Chris. He is in Gilbert, Arizona. I'm in Southern Utah. So I'm not going at him like he's my normal family practice doctor. We're doing this much simpler. So the process for this, even though we talked about this on the last episode, Chris, was about what goes with hormones, what we can expect, the side effects or whatever. But so I then had to go get my blood work done. I went and got my blood drawn, which was a pain in the butt for me. For some people, that's no big deal. But
Right.
my husband wasn't in town, so I had to wait till the kids were in school. I had to haul the baby down there who was screaming and kicking and did not want to be sitting in the waiting room at the hospital. I didn't want to deal with wearing a mask. He kept ripping my mask off. You know, that's still fun at the hospitals. And it was just a hassle. So for these women that are asking me, well, does our family practice doctor do this? No, we talked about that. You're going to be in these levels. Well, okay. So if you did go to Chris, if I did say, hey, I want to set up a telehealth call, what's the first thing you're going to do with me?
Well, first, obviously, you're going to reach out to our front desk here, and we're going to get you set up with a telehealth medicine consultation. We do telehealth a couple of different ways. Some people, they just prefer a phone call. So I will actually just call and then we'll go through a medical history that you've already pre-filled out online. It's just a quick few pages that gives me an idea of kind of where you're coming from. But essentially, we can do it via video or telephone. There's a couple of different ways. But that first phone call is basically to get to know the patient. You know, tell me your story. Why are you reaching out to me? What have you done in the past, or what haven't you done? What's been good? What's been bad? Um, Obviously there's a reason why you're calling. So let's get to the crux of the matter and then find out how we need to get that addressed.
And so for me, I was kind of speaking in generalities, although I was asking questions that I have myself on the last episode. But so for this episode, listeners, I am going to be very specific about myself. I am going to show you and walk you through because now we do have the results of my blood work. And so I'm going to let you know, okay, so here I am, Chris. I am 40 years old. I have 3 children. However, this last one was a gap baby, so he's a 6-year gap. So now I have an under 2-year-old. He'll be 2 in November.
Okay.
I'm still nursing.
Right.
As far as what I feel like why I would come to you is I have brain fog, I have mom rage, I have low libido
Sure.
in the way that not that I'm like, oh my gosh, I'm dreading my husband coming to bed. I'm going to pretend to be asleep. Not like that. It's just I feel like I'm being pulled in so many different directions that it's the literal last thing on my mind.
Sure.
So when it's supposed to be on my mind, it's hard to get to that point. I feel like I'm just got children, just any mom with young kids. I feel like they're clinging on me and mom do this and mom do that. And I'm spread so thin. My diet is probably, I joked with you when you said
Yeah.
I got your lipids back. And I'm like,
Exactly.
well, yeah, I eat nothing but coffee and Cheetos. So, and that's obviously drama because my husband makes fun of me that I eat so much, but I do not pay attention to my diet. I kind of
Right.
eat donuts and I eat Honestly, whatever I want. Jimmy John sandwiches, steaks. I don't care. I just eat whatever I want.
Sure.
So, what else would you need to know from me from that? Or is that pretty much good
I
job?
mean, yeah, I
You
mean
did it.
that's a great summary. We just kind of look at health history, surgeries, any current medications, just to get a feel for kind of what we're dealing with, current state of health, and then yeah, I mean, if there's any family history stuff that we need to know about, but it's just a
Sure.
general questionnaire, kind of a get to know you conference, and then what's next on the protocol. You know, what labs are we going to be checking? Are we going to do something that's standard? Do we need to go out of the box a little bit and get you something different? Um, just that's I just kind of play it from patient to patient to decide on how much or how little needs to be done, and then we just move forward.
Awesome. So, also, I think I mean, you tell me if this is important. I do go to the gym every day. I do get at least an hour
Sure.
of physical activity or more. I mean, obviously, more. I'm chasing around a 2-year-old, but I do go to the actual gym and do a class. And then no serious medical conditions, nothing like that. So,
Yeah.
what did we find out about me? Why is Gina crazy?
Well, how much time do we have?
Well, let me get our psychiatrist in here.
No, like you sent me your labs, and so I kind of reviewed those, and I figured we'd probably discuss a little bit about that as we went through today's consult. So I don't know how much or how little you want to divulge about your lab history here. Um,
I
but
don't
I
think
mean,
anything in there is incriminating.
yeah, it's pretty straightforward stuff. But I mean, just a couple of different things that the way that the Utah lab put these out. But like your vitamin B12 was 564. For their lab, their high normal is about 1500. So B12 plays a role in fatigue. It plays a role in muscle weakness. It plays a role in intestinal issues. So we look at B12. Specifically, we want to look at cortisol. Cortisol is one of those things that we check when we want to look at inflammation. We want to look at stressors. We want to look at, how well is your body able to handle the everyday stress that you're putting it through. And yours right now actually is doing really good. It's 10.7. So for whatever you're doing in your life right now, your body's taking that in and controlling what you need to have done. We looked at your DHEA sulfate. It's a precursor to testosterone, and it helps also produce a little bit of testosterone, or excuse me, estrogens in females. And yours was 240. It's kind of middle of the road. It doesn't have to be at 410, but it's at 240. Your estradiol is sitting at currently 59. So estradiol, I screen to make sure people don't have polycystic ovarian syndrome. You don't fit that bill, but it's something that we want to look at adrenal glands, make sure the adrenal glands are there, make sure there's not an ovarian failure occurring. But my biggest thing is screening for polycystic ovarian syndrome, where people literally can't lose weight, exercising. They can just do anything they want. And unless they're doing certain protocols or on certain medications, they're never going to lose any weight. So we definitely want to follow up on that. The next lab was your free T4, part of your thyroid gland. This is the most active, one of the most more active components of your thyroid. This actually is made by your thyroid gland. This is an important test that hardly anybody checks. So if you go to your primary care physician, you're going to get a TSH, a thyroid stimulating hormone, evaluated. And if it comes back in the normal range, guess what? You're going to be pushed off to the side. The important thing to note is it's your pituitary gland that makes that thyroid stimulating hormone. It's not even related to how your thyroid is functioning. Yes, it tells the thyroid to do things, but it doesn't look at how the thyroid actually is working. So the free T4 is 1.02 in you. High normal for your lab that you went to is about 1.5. So I talk to people about normalizing that value. I want it to B, high normal. I want you to be at the 95th percentile. I don't want you to struggle down at the 40th percentile. It can cause weight issues. It can cause sleeping disturbances, anxiety, fatigue, weakness, intolerance to cold, sensitivity to light, menstrual irregularities. They're all attributed to thyroid disorder. So we're going to look at the T4. The progesterone is one that is released by the ovaries. It plays a lot of roles in menstruation, pregnancy, and in men, progesterone helps. It's part of part of that evaluation we do for sperm production. So if I had a guy who came in for infertility, progesterone is one of those labs that, although it's not checked regularly, it's one of those that we might check in infertility issues. So some guy who's trying to initiate a pregnancy for at least 18 months and been unsuccessful, that's one of the labs that we'll have on there that we check for those guys. So ask questions if you want to ask questions as we're going
Yeah,
along.
sorry. I'm taking it in. I'm taking it in.
I'm just turning papers of
like
your labs that we got.
I shouldn't be worried about interrupting because
No,
I always
yeah,
have the
please
weirdest
do.
things to interrupt you.
Yeah.
Well, so go back to the 240, but it could be 400. Did you say that was estrogen? What did you say?
No,
That was not. It
that
was
was your
after the low
DHEA. That was your DHEA.
DHEA.
Yeah, you were 240. High normal for your lab is 410. So every lab has their normals. So I kind of look at the lab that they went to, use their normals for what is going on, and then
So where
decide.
I'm low or I could be improved on, what does that affect your DHEA? What does that affect?
So, I mean, it can, in some people, you might see hair loss, you might see masculinity change, you might have acne, menstrual irregularities, you might have increased or decreased hair growth. When levels are really, really low, you can have nausea, vomiting, you can have dizziness, you can have dehydration issues. But I look at it just to make sure that, if we have middle to low testosterone levels and your DHEA is severely low, why not try a supplement that we can get from a reliable source and see if we can't kind of jumpstart your own production of testosterone? If it's up higher, if it's way low, I still might replace DHEA, but it's not going to be my primary mode of treatment.
You know what's funny is that just triggered something in my brain. Isn't my prenatal vitamin with DHEA? Is that what it says on the bottle? Is that a thing?
I don't know if DHEA is in there all the time. There might be a prenatal
One
that's
that's
made by somebody
specific?
that has it in there, but
Because I think mine does. I
does it?
think so. Of course, I'm still taking prenatal vitamins because
Okay,
I am nursing.
sure.
So that's interesting that that one is lower than normal because I take it every day.
Right.
So, ladies, just because it's saying it on the bottle, you're not getting enough of it, obviously.
Right. And
Maybe.
that's one of the things with supplements. I always encourage people to buy from certain companies. We use a couple specifically that I know what is on the label is actually in the product. That's important to me. I don't just tell people to go run to Walmart, to Walgreens, to CVS, to your Joe Schmo market and buy something. I want it to come from a reliable source. So what's on the bottle is actually what you're getting because we want results.
That's good because that
And
is a
so many
generic
problems are
Smith's.
from it is. And the problem with that is they are not FDA regulated. I can put anything in a bottle, throw a label on it, and I could sell it to you as whatever. And, nobody's ever going to check it. So, yeah,
Yeeks.
yeah, exactly. Exactly.
Yeeks.
Yeeks. For sure.
Okay. Noted. Let's put a pin in that, ladies. Noted. So on the low B12, where you very first said I'm 500 and it could be 1500,
Right.
that's super low. So
I
is
mean,
that something that's as easy as upping your B12 or
sure. Yeah, I mean, there's different forms of doing that. Some people will do drops, some people will do capsules, some people prefer injection therapy. I mean, sometimes it's like you said, what is convenient, what's effective. Sometimes you got to find a middle ground in how I'm going to treat that just because of lifestyle and what's going on, that maybe you don't have as much control over. So, do I have some people who get drop shipped B12 capsules? Yes. Do I have people who like liquid drops? Yes, they can't take a pill and we can drop ship it. Do I have people who come to my office every week to get an injectable? Absolutely. They've tried other things, and the injections is the only thing that works for them. So um, every
Well,
shoe doesn't fit every person. So
well, and ladies, let me tell you this. Okay, so B12, when I was pregnant with this baby, it was the very first time I've ever had morning sickness. I've never had morning sickness with any of my other kids. And my prescription, I mean, not prescription, but she did say, try taking more B12.
sure.
And I took it once and it made me barf because I probably didn't take it on, I didn't have food in my stomach. So I didn't take it again. But that's interesting that she gave me that for that problem. But then later on, after I had the baby, and I acknowledged and could say, I have postpartum depression. This is what's happening to me. I think these are symptoms of postpartum. Again, she suggested taking B12.
Right.
So that is something very interesting. And I've obviously not taking it. I have a bottle of it, not taking it. But
Yeah,
there you
sometimes
go.
it's a quick, easy fix. It doesn't have to be this
No,
huge production. It can be just a
no.
few little changes in supplementation. So, I think last episode we also talked about when you get to that point, we can do micronutrient testing and we can tell you exactly what your body is lacking, and then have a supplement that's made specifically just for Gina, just for Jim, whoever walks through the door, and it will never be the same. Everybody will have their specific micronutrient testing done, and we'll make a supplement just for you.
Oh, I like that.
Yeah, it's kind of
I
nice,
like that.
actually.
Very special just for me. Then you're not taking, you see these people, or it's a joke on TV, whatever, and you're watching these people put handfuls of pills in their hands and like taking all of
Well,
this
the question
junk. And you're
is
like, what
why
are you even
are you
taking?
taking that, and do you even know what's in there? Um,
Yeah, obviously we don't now
So
from
we're
what you just
throwing
said. We
hundreds
don't know
of
what's in there.
dollars a month away when you can make something specific for you and know exactly what and why.
Oh, wow. That's so good. So this free T4, the
Hmm.
thyroid that you talked about, that they, and so I'm not that low. I'm 1.02 and you said
Yeah.
normal's about 1.5. I'm not that low, but you know what? I feel these symptoms. I feel like, well, I also have a baby that sleeps with me and still nurses in the night. So, yes, I'm not getting the sleep that I feel like I should, but and that may or may not be that or the baby, but also anxiety, also hair thinning,
Right.
also, these are things. And ladies, that's not that low. That's not that different, but I do feel these kinds of symptoms. So,
Yeah, it's not that low, but I mean, you're like 45th percentile.
yeah.
So, if somebody looked at that, they'd probably just say, Gina, get on your way. But
Yeah.
I look at it and I say, well, there's still lots of room for improvement. Why don't we try to get you to the 95th percentile and see if we can't fix the things that you came to me with problems?
Exactly. All right, sorry, go on. Move on.
All
Press
right,
forward.
so let's move on. So I think it's important to know that the free T4 it's important, but it's about a tenth of potent as the T3 is. So on the whole cascade of what's happening, the thyroid makes T4, and then there's a conversion process to T3 that happens. Primarily, that happens in your gut and your liver. And so, this T3 now, it's the most active form of your thyroid, and it's circulating and it does more than what anything else does. And that's one of the things that we check to rule out, hypothyroidism, autoimmune disease, can be caused by that. Surgery, radiation, iodine issues can cause a low T3. When it's really, really high, we're thinking maybe a Graves' disease. We're looking more for a hyperthyroidism rather than a hypo. So, same thing with this particular problem. Yours currently is 2.7. A high normal for your lab is 4.2. So if I look at your levels, the bottom of the percentile was 2.4. You're only at 2.7. You have a long ways that we can get in there and we can optimize your value. So I talk to patients about, hey, there are natural supplements that you can take that can try to help you convert T4 to T3. So we have a option here in our office. It's called Thyroid Revolution. what we've done is we've gone out and we know which things specifically can help that conversion more efficiently. So you can just take a supplement. It's 3 capsules daily, and we can give you a 90-day trial on that. If the conversion isn't happening like it needs to, then what I'm going to do is I'm going to say, hey, Gina, why don't we go out? Why don't we have a compounding pharmacy make a specific combination just for you, and then have you start taking that pill? Um, so many people only get put on a T4 pill, like a levothyroxine. So it's specific to treat your thyroid. But I had a lady yesterday in the office. She's been on the same dose for 15 years. Her complaints have never gotten better, and her primary care will not change her dosing. And I'm like, what? What? You've been doing this for 15 years and they won't change the dose, even though your symptoms never get better? And she's all, yeah, she lives in Midway, Utah.
Utah. Yeah.
And yeah, she's a Utah girl. And her family physician refuses to change it. And I said, so why don't we change it? Why don't we get you on something better? Here's my recommendation. You can go to your primary care physician and say, hey, can I do this? If not, then maybe we'll just have me do it. Because I want you to feel better. I want you to have your life back. And she has weight gain. She has anxiety issues. She's got a lot of the typical complaints that women have when they come to my office with thyroid disorder, and her primary care refuses. I mean, I went over her labs just like I'm doing with you, and I mentioned this, and then she says, well, I just reached out to my family physician via text, and he says he wants to wait a while to see if I should change it. And that's when I asked how long she'd been on that dose. And she said 15 years. And I'm like, how long are you going to wait before you ask to have something else done?
Wow.
So,
For you to live your life for 15 years, imagine being over, ladies, imagine being overweight for 15 years when maybe you didn't need to be. Imagine feeling anxiety for 15 years when maybe you didn't need to. Can you imagine? We have one life.
yeah,
We literally have one
absolutely.
life. Time is the only thing that we cannot generate more of. Why would you waste time? Oh my gosh. I would tell that doctor what he could do with 15 years
Mm,
because
mm,
that's painful. I don't even want to wait 1 year. It's if I'm not getting results, this is a world of people that it's like, if I'm not getting results, why? Because there are so many things out here that should be helping me get results.
yeah, absolutely. And the reason why I have her as a patient is there's a lady who lived right behind my clinic here in Gilbert, and we were doing weight loss and thyroid stuff with her, and then her and her husband moved to Midway, and so they had had a relationship before, and so they had seen each other, and it was about 4 months, and then they met again, and she was like, holy cow, what happened to you? He said, oh, I've been seeing Chris at New Level Wellness down in Gilbert, and you should call him. And
That's
so we did
amazing.
a telemedicine visit, and so we're doing things to help her change her life, and get it back.
That's amazing.
So
What a good story.
yeah, that one was really, really good. So I'm going to get back on task here
Yep.
so we can get some
Get
other
back
things
on
done.
task, Chris.
So one of the things that we always like to do is I like to screen for Hashimoto's. So Hashimoto's is
Yeah.
all related to autoimmune disease. We want to make sure that the inflammation of your thyroid isn't causing problems, and your thyroid globulin antibodies and your thyroid peroxidase antibodies came back normal. So definitely don't have any signs of Hashimoto's thyroiditis in you. So it's kind of nice. Another thing that we always check is vitamin D. Vitamin D plays a huge role in fatigue, hair loss, mood changes, muscle pains, osteoporosis, oral health. Yours came back at 79, and that honestly is pretty awesome. I don't see a whole lot of people above the low value of 30, especially in Arizona. Um, and you came back at 79. So I don't know if you're getting that through a supplement or if you're just got great genetics, but um,
I don't know. I drink
you,
vitamin D milk because that's what the baby gets.
okay, well, there you go.
And I spend time in the sun. So,
Well, we spend a lot of time in the sun
yeah,
in
you guys
Arizona,
in
but
Arizona do.
most
Yeah.
people are still deficient, which is
It
crazy.
must be that milk.
Absolutely.
I'm not scared of it because, like I said, I have that secret superpower of nursing where I lose all my calories. It burns calories constantly. I can't
Yeah,
keep up.
for
I
sure.
told Heidi Powell, I told her, I says, I need to add calories. I need to gain weight. I need to
Right.
put on, And so vitamin D, that's straight up just would be coming from the milk then.
Yeah, for sure, for sure. One of the other things we checked was the CRP. CRP is looking at another form of inflammation, and with CRP, we're looking specifically what's my cardiovascular risk for inflammatory disease. Are the blood vessels inflamed? How's the heart tissue? And so, for people who come back really high, I'm like, oh, do you have a family history of heart attack, stroke, coronary artery bypass graft? What else is going on in your life? And so we talk to them about diet changes. We have a nutritionist that they can meet with. We talk about exercise, getting them on a protocol. And then obviously, most of the time, there's either a thyroid issue that's going on, they have a gut issue with inflammation problems, they have something that we're also working on. So, specifically, yours is zero point 0.9. We really don't get too alarmed unless it's approaching 3 or higher. So yours is great, just like I told you before. Now we get to
Is that the lipids?
now we're
Oh,
getting to
this
your
is
lipid
lipids.
profile, and I hate you because of
So
this.
listen, everybody, he texts me this and he says, your lipid is insane. And I thought, and I'm like, oh, I'm so sorry. I know, because lipids in my brain is fat. And
Sure.
I eat Cheetos on the couch or Doritos with my baby all the time. That's just what we do. We hang out and eat Cheetos. And so I'm like, I'm so sorry. Just drink coffee, eat Cheetos. And he's like, no, you're not understanding me.
Yeah, no, I hate you because your levels are so good. That's why I text you. I couldn't believe
Yes.
how great they were. So for instance, like your cholesterol for your particular lab, less than 200 is considered great, and you came back at 168, which I don't like. Triglycerides, less than 150, you came back at 59. Your good cholesterol, your HDL cholesterol. This is one of the important tests to know. What good cholesterol is doing in your system. If you're a good candidate here, a good person with good results, 40 or above, you came back at 73. I don't know
Ooh.
in the last like 10 years if I've had anybody above 70. So congratulations.
Oh.
Um, so in that regard, I think yours are awesome. And then your LDL, the bad cholesterol, if somebody's less than 100, that's pretty awesome. You came back at 83.
Cool.
So yeah, I don't really like you right now.
You don't see a heart attack in my future.
No, honestly, at least like not right now for sure. So maybe time is on your side. Maybe when you get a little older, you won't have such great results. But for right now, they're pretty amazing.
Woohoo! Yay me.
So the next thing would be your CBC, your complete blood count. That we'd screen just for, we want to make sure you have appropriate red blood cells being made. You're not anemic. We look at your platelet cells. And yours came back completely normal. Your hemoglobin's 13.2, your hematocrit's 39.9, and then your platelets were 260. So all of that looks amazing. I don't know why, but your lab did not do the differential. The differential shows us neutrophils, it shows us lymphocytes, it shows us monocytes, eosinophils, basophils. It tells us that the blood components are normal, that there's not some weird blood disorder developing. I have a neighbor who came into me a few years back and he was complaining of fatigue. It was a simple blood test, but we did a CBC with a differential, and I got his lab results back about a week later. And he specifically came to me because he was that prime age for low testosterone, and everything he said made sense. I'm like, oh, this is totally going to be low testosterone. Testosterone was completely normal, but his lymphocyte count was crazy. So my buddy got diagnosed with chronic lymphocytic leukemia, and that
Wow.
was just from a simple blood test, where now he's been to an oncologist. Thank goodness for him. That type of leukemia typically isn't one that causes a lot of problems right away. It was one where it was kind of late onset. He got away without doing any chemotherapy for many years, but currently is doing chemotherapy, and overall has done great. But literally, it was just a regular little $5 blood test that got his diagnosis of leukemia done. So, um, and that's
That's
what I tell
huge.
everybody is, every blood test that I do always has a CBC included. So, um, we screen for even some of the weird blood disorders with a $5 blood test. So, um, moving on, I mean, we looked at your estrogens. I mean, your estrogen was 32.9. Your estrone was 29.1. Your total estrogens were 62. These are all different components of your estrogens. There's three different estrogens that we can evaluate, and then we circle back and we look at the total. For females who are perimenopausal, menopausal, postmenopausal, that may play a role. And if you get any therapy given to you, as far as like a bias cream or a pellet or whatever, but that kind of depends on what symptoms you present with, how old am I, and where am I on that life's journey as far as my menstruation. Is it gone? Am I cycling where it's all crazy, and do we need to try to regulate that? um, but your levels all came back perfect. And then I didn't get, but you have informed me that your testosterone, I think, remind me if I'm wrong, but I think you said your brother said your testosterone was 11
Let
and
me look
your
at it.
free testosterone was 1.1, if I'm not mistaken. But
I know he sent me words and I'm like, that might as well be Japanese, but I will forward this along. Yeah, he said my total test is 12, free. Total test is 12, free is 1.
okay,
1.1 or is it 1?
it might be one there. So specifically for, I haven't seen the normals for the lab that you used in St. George, but for me here, we use a lab that we overnight stuff to Jupiter, Florida, so I can get the results back the next day. But their testosterone runs from 6 as the very, very low in a female, but high would be 82. So
Whoa.
if that standard is the same at your hospital, then you're only about 75 points too low on your testosterone, or 70 points too low on your testosterone, if we wanted to maximize that. And then the free testosterone is 2.6 is considered high normal for our lab. And if you're at 1.1, you're 50th percentile. The distinction there is total testosterone is bound and unbound. So there are proteins, there are things that attach themselves to your testosterone, and essentially they inactivate your testosterone. It doesn't let the testosterone do what it needs to do to make you feel better. So the free testosterone is what we evaluate. That is not bound to any proteins that keep that from getting into the tissues and doing good for you. So the free testosterone, um, we would always want to make better. So by increasing the total testosterone, your free generally is going to go up. And then I look at something called sex hormone binding globulin, because there's a supplement called boron that we can give you, that you can take, that reduces the sex hormone binding globulin so that you can get more free testosterone into the tissues. So um, everybody's a little different. Sometimes all I do is put people on that supplement, and it creates enough extra free testosterone that their symptoms start to get better. Not everybody has to have pellets or creams or gels or injections or a trachea sublingual treatment to have their testosterone levels change. We can do little things and see what happens before making bigger changes.
That's what I was wondering about because you talked about what is it, muscle breaking or bone breaking? With that, it just those little bits of things that could do. Or what's another way that you said it's being blocked? What kinds of things block your testosterone?
Well, I mean, like in guys, for instance, you have this aromatization that happens. If I give, let's say your husband came to me and we started doing testosterone injections, during that process of breaking down that testosterone, typically a male's estrogens are going to start to climb. And so those estrogens then are going to fight the effects of the testosterone that we're trying to give him. So basically, we've just created a little bit of a monster. Yes, we've increased his total testosterone, but while we're breaking that down and making it usable, his estrogens go up. So normally we will put guys on an estrogen blocker. Um, there's a pill that they can take once a week. It's called the anastrozole. That's probably the most common one that we use, that we can have a patient take. Or there's something called DIM, that's a natural estrogen blocker. And it just frees up that testosterone and it keeps those estrogens suppressed. So your husband doesn't start crying in movies. And when you tell him to go outside and do his manly stuff, he doesn't whine and complain. He just sucks it up and goes and does it.
So you're making me think that high estrogen is the cause of whining and complaining and nagging.
In guys, yeah,
Chris.
yes, sometimes it is. It's so
Oh
funny
my gosh,
because
that's
just
awesome.
this morning, I had a guy in here who graduated in 2018, only 4 years ago, and we screened him, and his testosterone was under 300. So that tells me, I've got this 22-year-old kid in here who has low testosterone, which I'm sure 30 or 40 years ago would have never been. But because of the way that we live, the food, the processed foods that we eat, all the exposures that he's had, he came in here and he started doing testosterone pellets. And, for him to tell me this morning, he says, when you told me that testosterone would change my life, initially I didn't believe you. He says, and he brought his wife comes in with him, and so she came in this morning, and they told me of an instance where, with the testosterone, he is a completely different man. Like his confidence is back. He wants to go to the gym. In his job performance is up. His schooling, he is more motivated. He's focused. He's there. As soon as these pellets stopped working, at about the 4 month mark, all of those old symptoms started to return. He felt less confident. He didn't like to look people in the eye when he talked to them. He didn't think that he was good enough. He has a buddy that he hangs out with and does a ton of stuff with, and he hadn't texted him in 24 hours. And he's like, does he not like me? Did I make him mad? What's going on? And his wife is sitting there and she's like, everything is true. Like, he's like, did I make him mad? Do you think he's going to text me back? And she said a month ago that wouldn't have even been a thought for him. But
Yeah.
he was just very appreciative of doing something for him to get his life back. And he's only 22. I mean, that's kind of crazy to think about.
That's amazing. That's a really low level for that age.
Oh, absolutely.
That's terrifying.
It totally is. He should not have levels that low. And through the screening process, we didn't find anything else abnormal or wrong. I just think it's our lifestyle. I think it's the foods that we eat, the things that we're exposed to as we go along through life.
Like what? Be more specific in that.
Well,
Like
I mean,
Cheetos.
yeah, exactly. Bags of Cheetos at one time, processed foods. You can't go anywhere without looking at exposures to toxicities. When we talk toxicities, we're talking about things that cause harm to our bodies. All the processed food that have different types of sugars and dyes and things that make things taste good when they are just terrible for your system. They tear it down, but people get made to make food taste good so that you'll buy that crap. And
Yeah.
so that constant desire to eat those processed foods, I'm sure, cause a huge problem in how our body works and our testosterone production in men specifically. So,
So is that what you're talking about when we talked about the testosterone being blocked so that you say you have this level of testosterone but because it's being blocked by things you're only getting this level through. So I'm imagining that the processed foods are clinging to those, like if a testosterone is a little bubble and the bad things like the processed foods are attaching to that bubble, it's then not going to get through and create good testosterone in your body. Is that like what you're saying?
well, I mean, the answer to that is yes. Specifically, there are certain things that we know that attach, like sex hormone binding globulin, your estrogens. But I mean, the insult on the system of those processed foods, etc., you're going to have less testosterone being made. The system from your hypothalamus to your pituitary gland to the testes to make testosterone is going to be altered. Your system isn't going to know what to do, how to do it, and what concentration is that hormone axis working. And so you're going to have a delay in how much testosterone you make. You're going to have issues with how much production. So as men age, after the age of about 27, 28, naturally we're going to get a reduction in our testosterone production by 1 to 4% annually. And that's just being alive. That's not adding on any of the other stuff that's happening to us. So I'm sure some of these guys are losing between 5 and 10% of their natural testosterone production just by being here, um, doing what they're doing, you know. So
Yeah. Well,
it's epidemic.
it's just happening. It's the way that we're evolving. Have you seen Idiocracy?
I
Have
have
you seen the
not.
movie Idiocracy?
No.
It's all about how we evolve from being normal, educated people, but because the very educated people that put their like work first and not families
Hmm.
have evolved, and so they didn't reproduce, and so what's left is the idiots, because the idiots that don't care about work and don't care about education reproduce. Anyway,
Oh, okay.
it's funny. It's funny. It's just one of those stupid movies. But so I wanted to ask you some questions. I had some people write in to me or reach out to me, and they had a couple of questions. And the two that I think related were the perimenopause and the menopause. Where did I put it in my screenshots? This one, let me find it. But this one that I text you was, she was wondering about the weight loss during menopause,
Hmm.
how to naturally deal with the hormones that make you feel crazy without going into hormone replacement.
Great.
Also, this person has a partial hysterectomy, no uterus. So that's like that's a lot of questions in that one thing for
That's
this
a
one person. That's
that's a
very
big
specific.
question. You know, there's
So
so
break
many.
that down to make it not so big.
Yeah,
And
I mean, for instance, I mean, we have a lot of women coming in right now. We're running some weight loss campaigns through the clinic now, and so there are a couple of ways to deal with that. I mean, there are some people who still should have labs done. I'm a big proponent of recommending basic lab work. I mean, I kind of want to know your health status. Even though you may not be interested in doing hormone replacement, hormones isn't just the only way to lose weight. I mean, some people don't lose weight because they have food sensitivities that they have no idea that they're dealing with. So, for instance, I'll tell you a quick story. The other day, I had a guy come in who wants to lose weight. He's been doing testosterone, he's been on other things to lose weight. Well, we did food sensitivity testing. The guy loves gluten. He eats wheat like crazy. He eats breads. Guess what? His allergy, his IgG response was through the roof with that. Um, he loves tomatoes. Guess what? He's got a huge IgG response to tomatoes. Pineapple was on there. Um, he actually has a huge response on IgG to dairy products. What does he drink every morning when he first wakes up? So his gut has all this insult happening on it every day. The inflammation is up and his immune system is down. Toxicities are all over the place. And so, no matter what he does, he's found no ability to lose weight. So, we're doing a kind of a food slash detox with his body. We're going to do some elimination diet, and then we're going to do his micronutrient testing. There's other things going on. So I always tell that to people, just because we're not going to replace your hormones, let's go after other things that cause you to lose weight. If you're not getting essential vitamins and minerals, well, let's find out which ones those are. Let's get rid of inflammatory issues in your gut so it can heal, so your immune system can be good. You'll lose weight. It'll happen. And what we do is I have this company that I use that has, I mean, if you have ADHD, if you have hypothyroidism, if you have gout, if you have IBS, there's different protocols with natural substances that we can give you that can help fix and alleviate those problems. It's pretty awesome. But it all revolves around doing those additional tests so that we know what to give you and what concentration and how.
That's so amazing. And it is
So I don't
fairly, I
know if
mean,
that
it's not,
really.
well, yeah, it says even though she's going through menopause, she's maybe blaming the weight, not being able to lose weight on the menopause when really it could be something dietary. It could be something that she's just eating that she's
Oh,
having an
absolutely.
allergy to.
I mean, we've had a lot of success with I don't know if anybody. I mean, it's kind of out there now, but there's a drug called semaglutide that is on the market. It's originally made as a type 2 diabetes drug, but people were coming back to all these clinics and they were not complaining of, but they were reporting weight loss. And so this semaglutide, it's a once a week injection in your belly fat. And then what it does is it helps you feel full faster when you eat. You eat about a third of what you were eating. It's almost like going into an intermittent fasting state. So you have all these ketosis principles in the background where you start burning fat for fuel instead of craving carbs and sugars to feel like Cheetos and all the other crap, you know.
Yep.
So your body then starts creating a cascade where your energy is now being taken from your fat cells, and so you start losing weight that way. We've had huge success. We've had people regularly losing between 30 and 40 pounds in 3 to 4 months. We have a couple of people who are approaching 100 pounds. Um, but that semaglutide is pretty amazing for people who want to try to lose weight. They just do so good. The semaglutide is huge down here, and I'm sure it's in other places, but we do have a semaglutide program for people. And these ladies who are 65, who I have some who aren't exercising at all, they're not changing their diets at all, but we put them on the semaglutide, and because of the way that it works by, stabilizing their glucose levels and making them not want to eat as much. And then when they eat, they feel full for a longer period of time. They start burning fat and they're sitting on a couch. And in a month, they've lost 8 to 10 pounds and they haven't done anything different. Zero,
Yeah.
besides do a subcutaneous injection. So I would always do the screening first and then talk to them about options afterwards.
Awesome. That's great. This other one is, I think we talked about it as far as, is someone thumping? Someone thumping.
Sorry, there is a new massage, citrus
Oh,
massage being built, and it's in the suite next to us, and they just
well,
happen to
that
be working
sounds
on the
like it's
wall
going
that
to
we're
be
against.
amazing.
Yeah, they're
I'm
putting a
like,
lot of
Chris,
work in the
Chris,
last few
stop
days.
thumping.
I know. I'm gonna go tell them to
Sorry
stop
about
working.
that. Sorry about that. No, I was recording the other day with, I think, my mom or something, and they were putting up air filters outside my door. And I'm like, hello, can I
Do you
help
not know that
you?
I'm working here?
I'm working. I'm very important. Please stop. No. So this one, I think with me, it also affects me. So as far as lactating women,
Hmm.
you've said a lot of things are natural. So a lot of the things that you've recommended for me or that you would recommend for me are natural, and that wouldn't have an effect on it. But obviously, testosterone wouldn't be something, correct? Because you wouldn't want to alter your.
I mean, if you get down to the nitty gritty, can lactating women take testosterone? I think most people are going to say yes. You could, if that was something that was needed and you wanted to move forward with. I think probably pellet therapy would be the recommended portion of those treatment protocols, just because you have a consistent level being delivered to the system without any peaks or valleys. Once we put the pellet in, you're going to be consistent over the next 4 months. So that, yes. Other types of hormone therapy, I probably wouldn't do a ton, but certainly testosterone is not completely contraindicated. I think for everybody, there's always, what do I feel comfortable with? But there are a few studies out there that say that you can't do testosterone replacement. I just think there are safer ways to do that than others if you want to proceed.
Yeah, which maybe the things that she's feeling is the same things I'm feeling as far as the low B12 and the
Hmm.
the vitamin that you said that you would make like specifically to me. It sounds like those couple
Yeah,
things
the
would probably
micronutrient
be the
testing
same
is
thing
would be
she's,
awesome.
yeah, that she could test. And that goes into her next one because she asks about what's the relationship between testosterone and cortisol, since cortisol is a hindrance to weight loss and overall wellness. Does that make sense to you? Because it doesn't make sense to me because I don't know
Right. I
anything
mean,
about it.
when you
But
have high cortisol, guess what? It drives testosterone down. So, I mean, the biggest issue there is, do I have adrenal fatigue? Do I need to be on a supplement that's going to help with that? But, sometimes part of your job is to find the stress and try to eliminate that. Not all the time is that very easy to do, but cortisol, it's really funny. Like even in thyroid disease, cortisol is one of those big things with inflammation between the hypothalamus and the pituitary gland that will completely eliminate your production of T4 down the cascade. So cortisol is a very derogatory thing when it comes to testosterone because it drives it down, the thyroid because it makes the thyroid eventually not work as well as what it should. So our job is to try to find those stressors and to limit them, to help fix them, to give ways to cope with stress, whether it be, send our husbands away on a vacation or keep the kids and I'm going to go on a vacation for a while or something. But yeah, that's huge for cortisol and the direct high cortisol, low testosterone almost 100% of the time.
wow. And I am an advocate for getting away by yourself, having a little vacation. Like, honestly, because moms know that when you go on a family vacation, it's not a vacation.
Yeah,
It's
it's
a
not
family
really,
trip
yeah,
because
exactly.
mom's not getting a vacation. Neither's dad. I mean, really, nobody's getting a real vacation because you still, like when we're traveling, it's not a vacation, it's a lifestyle because I'm still doing dishes, I'm still having to cook the meals,
Right,
I'm still having to,
right, right.
it's those kinds of things. So yes, I am an advocate for you need you time too. So if you can start
For
to have
sure.
even 30 minutes a day, even sitting in the pickup line before the kids get in the car, like decompress, breathe. I mean, those kinds of habits will have an effect in the long run if you
Oh
start
yeah,
doing
for
them.
sure. Without a doubt. Without a doubt.
So another question was, and this is a good question actually. I didn't even think about this, but whether or not TRT or supplemental testosterone has long-term adverse effects as far as once you start it, do you have to stay on it forever, or do you lose the ability to produce your own? Your body becomes so dependent on it, or is it one of those things where it's you can stop it and yes, your levels are going to be low because they were low in the first place.
Exactly. That's,
So,
some guys don't realize that. Like, we'll put them on testosterone. They'll feel great. They've been on testosterone for 4 or 5 years. And then for whatever reason, they decide that they want to go off. Well, once you go off, yes, your levels are going to go back to where they were before. And if it's been 5 years, and let's say you're losing 5% of your testosterone production naturally over those years, then you're down 20-25% of where you were before. So now you're just going to feel even worse because your levels, instead of being 250, now they're 170. So um, yes, and when you're on testosterone, does your natural production get suppressed? The answer is yes. I'm getting a testosterone from an outside source. Your body knows that, and so the testes don't have to work as hard. um, it senses that the system is getting it from somewhere. So now I'm not getting that stimulation to the testes. My luteinizing hormone isn't in as high a concentration. So my testes are producing a quarter of what it used to. Can we combat that? Yeah, if you want to try to keep as much natural production going while you're on testosterone, we can have you take HCG, there, or clomiphene. There's other things that we can put you on to try to keep your natural production as high as possible while you're doing the testosterone. I have guys who do that because some unfortunate fellows get a lot of testicular atrophy when they get put on testosterone. The size of the testes just kind of shrink because they're not doing their normal job. Um, Most of us who are on testosterone don't have that issue or don't have to go through that. So we don't need HCG. We don't need extra medication to keep our testes normal size.
well, so
So,
tell me the difference between because HCG is something that they put men, that you would put men on anyway. Is that instead of or along with, always along with
so
testosterone?
HCG
Because,
could be an option. So HCG now is not made by regular compounding pharmacies. The FDA stepped in and said, "Hey, we're only going to have two companies in the entire United States making it legally. Novarel and Pregnell are the only two companies now. And so you used to have an option where we would do HCG as a primary source for your testicular production of testosterone. We just give you HCG and up your natural production. It might only go up a couple hundred points, but we were stimulating the testy to make its own. Um, Now, with the availability of HCG being, I don't know, I sent a guy to a CVS not too far down the street here to go get a prescription filled, and they wanted like $700 for a bottle of HCG that used to be $75. And so
Oh,
he's like, "No, what?
oh.
My testes can be small. I don't care. Like, I'm not paying $700 per bottle to make sure my testes stay the same size. They can shrink for all I care."
Oh,
So I'm like,
thanks,
all right.
Big
I mean,
Pharma.
there are other options. There are some peptides um, that we can give you to keep the testicular size elevated. But um, yeah, I mean, HCG was a good drug. It's not as available now, even when you get a prescription in. Sometimes it'll take 3 or 4 weeks for the pharmacy to even request it because they know they're not going to get it for a very long period of time.
That's annoying. Hmm.
It is
Okay.
very annoying. It's not been good.
And that's why we pivot, right? Figure out other things, other ways before
Yeah, I mean, what I
the
like
man
is,
tells us
hey,
we can't have it.
yeah, exactly. I never tell anybody you have to do anything. I'm all about let's find out what's wrong. Let's give you options, and then you get to decide. So, I'll give you my recommendation. Like, hey, if I were in your seat, knowing what I know, this is what I would do. But here are all the options. You can start wherever you want on this cascade, and then we can just kind of go along as we want. So, um, like I tell patients, at very least, you need to get your labs checked. These are the labs I recommend. Once you do that, let's talk. Once we talk, okay, here's where I would start based on these values. If you're not seeing results, then these next set of labs need to be done. I have some people who run the gamut from the very beginning. They get the same labs that you just did, plus they do their food sensitivity testing, and they also do their nutrient testing all at the same time because they just want to optimize everything. They don't want anything bad to start happening. As you age, things break down. We're mechanical, and so there are going to be changes happening that they want to slow or they want to try to completely eliminate, and nobody's going to blame them. With the use of peptides and everything that we have available, we can do a lot of amazing things if you want.
Well, why wouldn't you want to stay ahead of it? You know what I mean? Like
Good
it's so
question.
funny. Instead of constantly trying to keep up with anything in life, I want to stay ahead of the laundry. I want to stay ahead of the dirty house. I want to stay ahead of my goals in my office. I want to stay ahead. Why would you constantly just be like, I'm trying to keep up with my health.
Keep your head
I'm
above
trying
water,
to keep
barely.
Yeah, it's like that's not good
Well,
management of
eventually,
your
what
own
happens
body.
is you fall below the water and you can't get back up. So,
Yeah. Yeah, treading water only helps you above water for so long.
yep,
Well, the
it's hard.
last the last one, I'll just ask you one more cuz I
Okay,
know you're
yeah,
so
go ahead.
busy. My question was cuz it's kind of full circle what I started with saying why everyone, but ladies specifically, I'm talking to you, why wouldn't you just go get this blood work done? It's so easy, and it's so easy to talk to Chris and have him talk to you through like what he just did for me. And honestly, for me, I got out of that. I could fix a lot of my problems so far. I don't necessarily need to jump to testosterone yet. I feel like I could get a vitamin made for me or up my B12, or you know what I mean? I don't feel like I'm so far past the point of no return yet that I need to start thinking heavier. And that was great to know because from what I'm thinking in my brain, I'm like, I need testosterone. I'm sure of
Right.
it, you know? But even simple things like that, it's just go get the levels done. And so here's my question.
Okay.
What is the difference between the saliva test and the blood work that I just did? Do you get the same results from that?
I mean, you do get the same results. I think blood testing overall is more accurate than if you do saliva testing. Here's kind of the great thing about saliva testing, and one of my colleagues and I were talking about this just a little bit ago, is saliva testing is convenient. Guess what? You want to see me? You don't like yourself. You're a mom. You've got a 2-year-old sitting at home trying to get to a hospital or to a lab center and sit and wait. I can't get in at the right time. I don't have time to do this crap. Guess what? We can drop ship a test to your house for saliva testing, and you can do the saliva test. You can drop ship it back to the center, and then we can have results back in 7 days. There's also blood spot testing where you can prick the tip of your finger. You can drop the blood on 5 different spots. You get that sent in 7 days. Guess what? I have the results back. For our nutrient deficiency testing, guess what? You pull 3 strands of hair, you drop it in this little baggie, you ship it back to the company, and in 7 days, I have your labs back, and we have a consultation just like you and I are talking right now about all of your results. So, literally, if you don't even want to leave your house for any of this, guess what? You don't have to. We work with companies that drop ship. And, if you're here in Arizona, we have a phlebotomist that will travel to your house, sit you down on your favorite chair, and pull your blood. And she'll drive away. She'll come to the office. We'll spin it down and we'll send it out, and we'll have the results back in a few days. So we try to make it as convenient and easy as possible for people who want to feel better. I mean, if you want to take advantage of the program, great. Let's do it. If you don't, when things get bad enough, when you can't tread water any longer, call us. We'll help you.
That's amazing. That's amazing. I really appreciate that. That was a perfect answer to that because it's everything: hair, saliva, blood, easy from your home.
Yeah, I mean, literally.
No
And
big
then the
deal.
companies we use for supplements or for meds, I mean, I use some of the biggest 503B pharmacies in the nation that can ship to any state in the continental US, and actually even Alaska and Hawaii. Um, one of the supplement companies we use is a company called Vitamin Labs. It's in Canada, and the reason why we go to them to have your micronutrient testing evaluated and your supplement made there is because they do have something like the FDA for supplements. So what is in that bottle dang well better be in there, or else they're going to get hammered. They're going to get fined. So we use them specifically for stuff that's going to be made for you. Is it probably a little more expensive than Walmart? The answer is yes. It's going to be more expensive than Walmart, but you're going to know what you're getting is the best in the entire world. They actually go out and they look for places to get their supplements from to make what they need to make. So they do a great job. I mean, if you look at them, you look at their reviews, they're tremendous. And I know the owner of the company personally. He came out and did some workshops in Arizona, went to him, met him. And so I've got his number on text. So if there's any issues, questions, concerns, I can call the owner of the company and get it fixed immediately. So it's kind of cool that way too.
Well, and you said right there, perfect point is I just spent how much money in all of these bottles. Women, we know how many bottles of prenatal vitamins we go through. I'm buying specifically the one that says DHEA, which I didn't even know what it was. It was extra. So I'm like, yeah, I need that. So I'm buying these specific things, and my numbers are completely in half, and I'm taking it. You guys aren't. You women aren't taking it because you're not taking this prenatal vitamin with DHEA. I'm taking it every single day, and I'm still in half of what it could be. So there's
Right.
something to be said. You're not, it's quality. You know what I mean? It's what are you willing to pay for? Well, I just wasted a whole bunch of money for the last 3 years on something that was supposed to be helping me. I would have rather been paying a little bit more for something that was actually helping me. You know
Well,
what I
it's
mean?
it's like the testing. It's just nice to know where you stand, and when you get it, what am I taking and why? It's not just
Yeah.
because the bottle says I need to take it. You don't really know what's in there. You don't know why you're taking it, and the cost. Like you just said, if you take this one and this one and this one, you're taking 7 different pills. Are you really consistent with those? Am I getting what I really need? If I can take your 10 bottles and I can put those into 2 capsules being made by Vitamin Labs, are you going to be more consistent in taking 2 pills or 10 pills? You're going to
Yeah.
take
Oh,
two.
whoa. Yeah,
You're going to
absolutely.
stay consistent on your therapy. You're going to see results. You're going to be happy. You're going to feel better. You're going to tell your friends, hey, look what I'm doing. I feel amazing. I'm doing this. Why don't you want to do that? Why wouldn't you want to feel better? So I think all around, I mean, it's like anything else. You kind of get what you pay for. Our prices are cheap. For a consult and stuff, I think we are extremely low. In the near future, I'll probably raise my prices for what we do. Um, but we, again, I mean, we want to help people. I want to see people like the guy this morning, where it literally has changed his life. I have ladies coming in every day to get their semaglutide shots who say, we have a scale here that looks at 13 body components, and you look at their sampling of their BMI has dropped 8 points. They're down 47 pounds. Um, their metabolic age went from, hey, I'm 47, but it used to say I was 52. Now I'm 48. I'm almost back to where I should be, and how my body is aging. Those are the things that we're after. Those are the success stories that we want to see in this clinic. We want people to do better, feel better, and spread the word.
I know that. I am spreading it. I know that. I believe it. And you are,
Yeah.
I'm sure we'll have plenty of questions and we'll be seeing Chris again. I really appreciate you. I've taken up so much of your time. Reminder, everybody, this is newlevelwellnessmedspa.com or new level. It's just new level on Instagram, isn't it? Let's see.
New level underscore wellness.
New level underscore wellness on Instagram. And there's a link tree in there, and you can get to everything you need to get to in there, or reach out to me and I will hook you up with Chris. So
Heck
I
yeah.
really appreciate you coming on part 2. That was awesome. I
Thank
learned
you.
so
Thanks so
much.
much. Yeah, for sure. Without a doubt, is awesome.
Thanks for telling me I can keep eating Cheetos.
I don't know that I really said that, but you can for
So
right
pretty
now.
much continue doing what I'm doing. Okay,
Yeah,
got
don't make
it.
any changes in your lifestyle whatsoever,
Don't do
please.
anything. You're perfect just
Yeah.
the way you are. Nope, nope, I don't believe it.
After you get
Thanks, Chris. I appreciate you.
through with that kid, then we'll recheck your labs and see if they stay the same or not.
Oh my gosh, no way. No way. I have, ladies, I have gained weight in my life, and it was when we very first left to go traveling. In 2017, I was probably same thing, like 120 pounds when we left, and we did our first 3 months in Europe. And I'd never weighed myself, but the only thing I had was a pair of jeans that had tears all over the legs, and when I left, they were cute, whatever. And when we were coming home, I was sitting in the airplane looking at all of this extra weight squeezing
Extra,
out of those holes
yeah.
in the jeans.
You're like, hey, I see
So
this
that
extra skin
it
sitting
is
here.
something I have to worry about when I'm not nursing babies. So,
Yep,
yes.
for sure.
Oh, thanks, Chris.
All
I
right.
really
Well, thanks for
appreciate
having
you.
me on. I got patients to see. I got to go.
Yes, you do. I'm so sorry. Thank you.